Do you fear you're exposed to someone with HIV or someone close to you has been detected HIV positive? Well, wait. First thing, do not panic. Yes, I understand HIV creates a lot of fear, stigma, apprehension, but lot of this is actually not necessary and it actually originates because of misinformation and confusion related to this disease. So hello friends, I am Dr. Piyush Chaudhari and in today's video, I am going to break down what is HIV and AIDS, how it spreads and how it does not, and let us see what are the most important facts related to HIV which can reduce our fear. So first and foremost, what is HIV? So HIV, that is the human immunodeficiency virus, is a virus which attacks our immune system and weakens it. But before we go into depths of what is HIV and what it does, let us see how it spreads and how it does not spread. Because how HIV spreads is the single most important factor which drives all the fear, misconception, and stigma related to this disease. So, to know how HIV spreads, first and foremost, it is through unprotected sexual exposure. Now, here the highest risk is in male to male sex, followed by male to female sex. Second, it spreads through blood contact, especially when people share needles or there are injuries with sharps stained with blood of a person having HIV. And third is the vertical transmission, wherein HIV virus spreads from a positive mother, especially when she is not on treatment, to her child during pregnancy, during delivery, and up to certain extent during breastfeeding. But what is most important amongst all these things is that every exposure does not lead to spread of HIV. Even in these three routes that we discussed, each exposure does not cause HIV. Now coming to what cannot spread HIV. Now this is even more important because if we want to reduce the fear and stigma about HIV, it is very important to know that certain things cannot spread HIV from a positive person to a negative person. So that includes routine hugging, shaking hands, kissing, even deep kissing, sharing this food, staying in the same house, working in the same office, using the same washrooms or urinal seats, then playing with kids, going in crowded places. All these things do not spread HIV from one person to another. So, routine day to day casual contacts are essentially safe as far as spread of HIV is concerned. Now that we have understood how HIV spreads and how it does not, let us see what HIV actually does once inside our body. So, HIV virus, like I told in the beginning, attacks our immune system. Now, it attacks our immune system by attacking the CD4 lymphocytes, which are a type of white blood cells in our blood. Now, what happens is this virus, as it is replicating itself from one copy into 2, 4, 8, 16, and so on, perhaps several lakh copies every single day, it keeps on attacking the newly formed CD4 cells in our body. Now, this gradually breaks down our immune system, even if it was normal to begin with when the infection occurred. Now, if this process goes on uninterrupted in absence of treatment, then the person can reach the advanced stage of this HIV infection called AIDS, that is acquired immunodeficiency syndrome. So basically, when a person gets infected with HIV, that person can spread to the advanced stage of AIDS only if not treated well in time. So the good part over here is that if the person is started on appropriate treatment, what we call as highly active combination ART, that is antiretroviral therapy, then most such patients never progress from the primary HIV infection to the advanced stage of AIDS. So what does this treatment involve? So basically highly active combination ART involves a combination of three antiviral drugs which usually attack at three different ways over the HIV virus, and they prevent the virus from multiplying or replicating inside our body. So the essential aim of the treatment is to stop HIV virus replication inside the body so that it is unable to attack the newly forming CD4 lymphocytes, which then keeps our immunity normal like any other person who does not have HIV. And if this is achieved, then such a person can very well lead normal healthy life in spite of having HIV infection. Yes, a person with HIV infection can lead normal healthy life. How? Well, so there is a concept which is extremely important to the center of this all, and that concept is U is equal to U. So what do I mean by that? Undetectable is equal to untransmissible. So any person who has got HIV infection, if that person is started on appropriate combination HIV treatment, which is just one pill in a day, when the person's virus gets arrested and is not able to replicate in the body and immunity remains normal. So such a person whose viral load is not detectable by the available tests that we have cannot spread that infection to his or her negative partner. Now, this is extremely important because if in a couple, one partner happens to be HIV positive and the other partner happens to be HIV negative, so not having the infection, then if the partner who is positive is on appropriate treatment without missing any doses of the pills, and that partner's viral load is totally suppressed, then such a person cannot spread it to that person's partner who is negative. Because of this, these people can live normal life, normal married life, and they can have natural family planning and they can have kids naturally without converting the negative partner into HIV positive status and without passing the virus onto the child. So because of this concept, which has been proven beyond doubt through several cohorts of thousands of people, that U, that is undetectable, is equal to U, that is untransmissible, has revolutionized the way HIV positive patients lead their life. So is there any cure for HIV, or is there any vaccine to prevent HIV in such cases or in other people who have high risk behavior or exposures? Well, one of the most discussed part about HIV is whether there is any cure or whether there is any preventive vaccine available against this disease. And of late, because of availability of certain antiretroviral drugs which are available in injectable form, of course they are going to be available in our country soon, not yet available, many people have started believing that there is a HIV vaccine which is available. But no, let me make it very clear that this is just injectable antiretroviral drug. So it is a antiviral acting against HIV. Now it can be used to prevent HIV as a pre-exposure prophylaxis or in near future as a post-exposure prophylaxis. So after the exposure has already occurred, but it is in no way a vaccine. I mean, vaccine remains quite elusive because of the way HIV virus mutates itself and modifies itself. Although scientists have been on this research for last three and a half decades. About the cure, yes, there are some 8 odd cases world over where it was reported that HIV was completely cleared from that person's body, but it was after some extreme scenarios where the person happened to be either having some blood cancer, underwent bone marrow transplant, where the whole cell line in his or her body got changed. But those are very few cases and very rare and with some other reasons. So far, permanent cure of this infection is also equally elusive. But what is heartening is that with regular antiretroviral therapy without missing any day's dose, HIV nowadays is far away from the deadly disease that it used to be 25-30 years back. Because the pills now are in a combination form, single tablet most often, very few side effects. So with good compliance with the medication, the person can lead normal life. So HIV has essentially become a chronic manageable disease. Like people have diabetes, hypertension and all who take medicines for years together. Even HIV patients taking medicines for long term can lead normal healthy lives, and they do not succumb to any opportunistic infection because their immunity is maintained normal. In fact, like diabetes, these patients nowadays have to monitor their metabolic functions like lipid levels, whether they have any blockages, whether they have any higher risk of strokes, and take care of those parameters. So we have come from that phase 20, 30 years back where people used to die of infections to that phase where people survive so long that they get many of the non-infectious complications like the chronic communicable diseases like diabetes, heart disease, stroke, cancers, which other people with other medical comorbidities also can get. So the real issue with HIV is not the disease itself or the virus itself. The real issues is in the misinformation, misconceptions, the stigma with which we behave with someone who has got HIV, the way we judge that person's morality, which is of course that person's personal space and nothing to do with you and me. And all these things lead to a lot of fear. So because of this, people get tested late, do not take treatment, do not take necessary precautions. But friends, as a takeaway from today's video, let me assure you, all of you, do not panic about HIV. Do the right test at the right time. If someone happens to be detected positive, that person can be started on appropriate treatment, which when taken regularly can make this disease absolutely manageable for several years. Such a person can lead normal healthy life, even have normal healthy family life like any one of us. And last but not the least, instead of falling prey to any fear and misinformation, always seek correct advice from qualified doctors when it comes to diseases like HIV. Because, like I always say, stay informed, stay healthy.